Hello everybody, let's talk about how to get pregnant and give birth with uterine fibroid. We have discussed uterine fibroid in our previous videos, and we said that uterine fibroid is an overgrowth of the smooth muscles and connective tissues of the uterus. It's just an abnormal growth. When something loses its sense of control, it overgrows. Uterine fibroid is in women. It happens mostly in reproductive age women, and as a way of introduction, we said if there is nothing in the uterus, uterine fibroid tends to occupy. So if there is no baby, uterine fibroid tends to occupy. So it's seen mostly in reproductive aged women, people above 25. That does not mean that you cannot see it in people less than 25, but mostly people above 25 years of age. And as the person's age increases, the higher risk of uterine fibroid occupying. My name is Dr. Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. Subscribe to my YouTube page at Dr. Adazion at Talks-with-Dr-Adazion. Follow me on Facebook page at Talks-with-Dr-Adazion. I'm also on TikTok and on Instagram with the same name, so let's go on. It is rare for uterine fibroid to stop someone from conceiving or getting pregnant and having her babies. However, there are fibroids and their location that can stop someone from getting pregnant. When someone has what we call cervical fibroid, when the fibroid is in the cervix, it will stop the movement of sperm upward to enter into the uterus to fertilize the egg. So the person may not be able to get pregnant with cervical fibroid. When there is fibroid in the conal end, the conal end is where the fallopian tubes join the uterus on each side, right and left. So if any fibroid is occupying either or both of the tubes, it may stop the movement of sperm that have entered into the uterus to move to the tube to fertilize an egg. Fertilization of egg, that is conception, pregnancy, takes place first in the tube, in the ampulla of the tube, this place. So it takes place here, and after fertilization has occurred, the embryo, that is the baby that is formed, is called embryo. It moves down to enter the uterus. So if there's any fibroid stopping the end of that tube, it may not allow sperm to move to fertilize. If any sperm is able to escape and fertilize the egg in the tube, coming back may be difficult, and so the person may come with an abnormal pregnancy known as ectopic pregnancy. If there's a huge fibroid inside the uterus where the baby lies, it may be difficult for it to allow implantation or a baby that has fertilized to grow. Big fibroid in the womb can push out already established baby. So that is how uterine fibroid can cause someone not to get pregnant. When the fibroid is also big, it may increase the length and the time the sperm will take to fertilize an egg. If there's any fibroid in the tube itself, it can stop the egg from being fertilized or stop the sperm from moving to fertilize the egg. So those are just the ways for uterine fibroid to stop conception. Someone has uterine fibroid and is coming for inability to conceive. Number one is that we'll look for other causes that will prevent the person from getting pregnant. We'll start with the husband or the partner. We'll find out about the partner and be sure that every parameter in the partner is fine. If it's fine, we'll go on to examine the woman. We'll do some barrage of investigations, and when we have finished all the investigations and find out that there is nothing wrong with this woman except for the uterine fibroid, that is only when we go to remove that uterine fibroid. And most times when you remove it, the woman gets pregnant. So myomectomy is one of the ways for a woman to get pregnant. When a woman has fibroids in those places that I have mentioned, and we'll find out that it's stopping this woman from getting pregnant, we'll go remove the fibroid. If the fibroid is in the womb, when we finish removing it from inside the womb where the baby lies, we reconstruct the womb back. And after we have reconstructed the womb back, most times we put intrauterine catheter, especially in this part of the world. We put an intrauterine catheter so that it will keep the womb open. When you finish removing fibroid inside the womb, you will close. When you close back and you do not put anything inside the womb to keep it open, that womb will close together and they will match together, and the person will now come with, she's no more seeing her menses, and that pregnancy is not occurring. That means adhesion has formed and the womb has matted together and closed as well. So when we finish reconstructing the womb with uterine fibroid remover, we put a catheter to keep that place open, and we give the person some hormonal drugs so that the womb will grow well. Now, most times we do that surgery in what we call the follicular phase, just immediately after the menses, because we don't want the whole uterine linings to grow before we remove it. We want just the one of the layers to be grown. We go and remove it so that other parts will grow together and the person will still see her menses. So these are the precautions we take when we want to remove uterine fibroid, and especially for someone that is trying to conceive. So when we have this fibroid in these places, we remove, the person goes on to get pregnant. For someone that has fibroid and has never tried to get pregnant, we do not encourage removing the fibroid, especially when it's not symptomatic. When it's not giving the person any symptoms, it's just a silent fibroid there, small in size, sleeping quietly, we allow it. We encourage the person to go and get pregnant. You get pregnant, even though in pregnancy the fibroid may grow further, but it may not affect your pregnancy. So you can have your pregnancy with a fibroid in the uterus and there is no problem, especially when that fibroid is outside the uterus or in the muzzle. So person with fibroid can go on, conceive, and nothing happens. Someone that has tried to get pregnant with uterine fibroid and the pregnancy did not come, and we go on to remove the fibroid and the person yet has not gotten pregnant, we can advise the person further for intrauterine insemination, where you just get the sperm of the partner or a donor sperm and you wash it and insert it directly into the uterus. Most times the person may get pregnant. Now, if this has not worked, we'll go on to encourage the person to have in vitro fertilization. In vitro fertilization means getting the person's egg after you have prepared the person and stimulated the person, get her eggs, then get the partner's sperm, fertilize them outside and push back into the uterus, implant them in the uterus. When we do this, we do not encourage it to be done with someone that has uterine fibroid, because the failure rate may be high. So if you're doing in vitro fertilization, whatever that will cause the woman not to have a successful fertilization, we avoid it. So when you have someone that wants to go for in vitro fertilization, you see most times we encourage them to remove the fibroid. Remove the fibroid, prepare the womb so that when the baby is coming, the baby is coming alone. Now, we expect a good outcome. The last part is, if you have uterine fibroid and you have gotten pregnant, and for any reason that pregnancy is growing fine, and in between you start having preterm contractions, and before you know it, the fibroid pushes the pregnancy, we encourage the person to go on to remove that fibroid. So fibroid in the uterus cannot stop someone from having pregnancy. However, when you have it and there's a lot of complications, especially to the mother and to the baby, a fibroid that is not going to stay together with that baby and is trying to push out the baby. When it finally pushes out the baby or you finally delivers the baby, we encourage that fibroid to be removed so that your next pregnancy will be fine and calm. So uterine fibroids may or may not prevent you from getting pregnant. However, when it happens and there are some complications with it, we encourage you to go remove the fibroid and have your baby. When it is in strategic places and you are finding it difficult to get pregnant, we encourage the fibroid to be removed. When it's lying quietly with the baby and there is no problem, we leave it untouched. If you have finished giving birth and you're about to enter menopause, we leave the fibroid alone. This is how to get pregnant with uterine fibroid and have your babies with uterine fibroid. Thank you for watching to this point. If you have not subscribed to my page, my name is Dr. Nkiruka Bridget, also known as Dr. Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. Subscribe to my YouTube page, share this video, leave a comment, like it. Follow me on Facebook page at OBGYN Talks with Dr. Adazion. I'm also on TikTok and on Instagram with the same name. See you next time. If you have any question, any video you want us to drop the question in the comment section. I am going to discuss it. Thank you for watching. See you next time. I love you.